Today's webinar from the Manitoba Fitness Council talks about the fitness screening tools, including the PARQ+, the ePARmed-X, and the Get Active Questionnaire. You may have heard of all of these documents before, you may have used some of them, but let's figure out and work through some options together as to which one makes the best use of your information and which one it would be a required screening tool for you to use, regardless if you're a personal trainer or group exercise instructor. The PARQ+ is intended to be a simple self-screening tool that is used by fitness trainers and coaches to determine what the safety risk or risks are associated with the people that you have in your class or as a personal training client based on their health history, current symptoms, and risk factors. So the PARQ+ is a great option for fitness instructors so that we are not assessing these details on our own in isolation. We're using pre-developed questions to determine if people are safe and can be safe to be in our classes. One of the risks that we're really looking to identify in these clients is the risk of sudden cardiac death. Now, sudden cardiac death occurs most frequently in adults in their 30s and 40s, affects way more men than it does women, and it's something that we need to be aware of when we are teaching exercise classes to people who are in these age groups and above. For those of you that have seen the PARQ has been around for a really long time. The PARQ was developed in its first rendition about 15 years ago. And at that point, it was based on the evidence that was provided by a number of doctors and what they thought were the best questions to ask people who were new to exercise or people who could be had been taking a break from exercise or just those who were registering for an exercise class. After about 15 years, the doctors reassessed the questions and have developed the PARQ+, which is a research-based information tool for you to use. It is available at www.ePARmed-X.com. A lot of organizations use the PARQ+, organizations that we have listed below, Fitness Leadership Canada. If you belong to one of our provincial associations across Canada, that would be the Fitness Leadership Canada. The NASM also uses the PARQ+, the government of Manitoba, the government of BC, just so you can get an understanding of who are the organizations that would use this document in their regular everyday activities in order to ensure that the people that they are teaching in their classes or in exercise sessions are safe to participate. So why should you use the PARQ+ with your client? We really want to find out, number one, if there are any pre-existing medical conditions that might be aggravated or develop into something more serious if people were to exercise with you. We want to make sure that we get to know our clients. So when you look at onboarding clients, there's often a registration form, a next of kin. We want to know what they do for a living. There's lots of questions that we want to ask. But it's part of that onboarding process to use the PARQ+ as a tool to be able to develop a real profile for each client. There are 7 questions. We're going to go through those in a little bit that will identify anyone who has a pre-existing health condition and that should be addressed by a medical professional before beginning an exercise program. So a few years back, there was a stat that was developed and it basically indicated that 97% of people should be able to exercise without getting medical clearance. However, there are those 3% that we have to be worried about, or people who have not been under a doctor's care for a long time and may not realize that they are someone that is at risk for some sort of sudden cardiac event or other event that could be detrimental to them in the future. If you are a partner of Fitness Leadership Canada, it is required that you use a PARQ+ for those participating in your exercise class. This doesn't have to be a written, it can be a verbal PARQ+, just so that you have that understanding. And the PARQ+ can protect you from training liability because it shows that you have done your due diligence. This is also a situation where we could be at risk of someone not sharing the appropriate information. And we're going to touch on that a little bit later. The PARQ+ is not an extensive medical history. There are 7 questions that can identify whether an individual may have a pre-existing health condition that should be addressed by a medical professional before beginning an exercise program. But we do not necessarily need a full medical history on our clients because there's nothing that we can do with that information that's different. So for instance, if I know that someone has had a hip replacement in the past, but they are cleared for exercise, I don't necessarily need to know all the details of that procedure and any other medical history that involves that. If they're cleared for exercise from their medical professional, that is all that we need to know in order to be able to work with them in an exercise setting. Now, there are some limitations of the PARQ Plus. Again, we talked about a second ago, it doesn't give you that full kind of medical history. It also cannot identify a specific pre-existing health condition or why it exists. So we often get people come to a class and they say, oh, it hurts when I do this, or it hurts when I do that. Well, if that is the case, then we are not able to diagnose or determine what their injury is. Instead, we would send them off to a medical professional that can perform a diagnosis on that issue and give them some advice for kind of going forward or beginning an exercise program. Many clients think that it's only exercise, I can do it. But if they have not exercised for an extended period of time, their body may not be able to handle the increased stress of starting an exercise program. This is why we want to ask certain questions when we are, again, onboarding our new clients. You want to be able to spend a little bit of time with them, really get to know them, get to know what their goals are, what they've done in the past, how long it's been since they actually were physically active to a point where it was regular physical activity, 4 to 5 times per week. Now, how can the PARQ Plus protect you from training liability? Here's where the issue can arise. If a client fails to disclose a prior heart condition or experiences an issue while exercising with you, it can reduce your liability. We've also seen situations where someone has filled out a PARQ Plus and has been totally clear. So they have had no issues whatsoever. Then we come to find out after they have been working out with us and are hurting themselves on a regular basis that they had a pre-existing back problem or a pre-existing diabetes that was not disclosed, and blood sugar can go a little wonky when you have people in an exercise setting. So if you fail to use the PARQ Plus with a client and he or she experiences a medical issue, it could be your fault for not conducting a proper screening before exercise. So stop it before it happens and administer the PARQ Plus. How can the assessment help you to establish professionalism with your clients? We are exercise professionals. We want to make sure that people come away from our classes and our sessions thinking that we are, in fact, professionals. So an important function of a fitness leader is to help clients remove barriers or overcome any obstacles that could keep them from experiencing the benefits of exercise. One of the challenges is with the old PARQ, it would, since we weren't able to evaluate people's answers, as soon as there was a positive or a yes on the PARQ Plus or on the PARQ, then what would happen is we would have to send them to their doctor so that the doctor could clear them for exercise because they'd answer yes to one of the questions. The PARQ Plus does not do that. So PARQ Plus asks additional questions and then provides a directive to the fitness instructor based on the answers that the client has given. So the PARQ Plus is a tool that could save a client's life and is not a step that you should remove from your process when starting a new exercise program with new clients. When is another time that we could look for getting a PARQ Plus? When it's been over a year or when there's been a change in health status from someone who you have been exercising with. Besides ensuring that a client can safely begin an exercise program, it also provides the benefit that it establishes professionalism with a skill set and helps a client to change his or her life through exercise. Helps us to understand where they're starting. Now, this is not a goal setting venture. This is basically, it is just kind of a snapshot in time of their health symptoms and with relation to these kind of 7 questions. Now, who can use the PARQ Plus? We want to make sure that people are not making up their own versions. We've seen this in the past where people want to put their own logo on it, or they want to change a couple of words because they don't like the way it sounds. Maybe they think it sounds negative, or maybe they think it sounds like it will turn people off from exercise. The PARQ Plus is to be used in the form that is distributed. And we're going to talk about what that looks like in a little bit. But it can be used by individuals, qualified fitness exercise professionals, organizations, researchers, health and allied health professionals involved in health and performance related physical activity initiatives. So really pretty much anyone. So even organizations like Sport Manitoba will use a version of the PARQ Plus or the PARQ Plus itself in some of their screening tools when they are registering people for their programs. Why were the PARQ Plus and the ePARmed-X and questionnaires created? There was a collaboration of international authorities. So this is, when you look at who is actually using the PARQ Plus, I elaborated on it a little bit, but it is being used kind of all across Canada, all over North America, and even all over the world. And so again, the reason for using it is to reduce barriers for low and moderate intensity physical activity participation and exact the identification of those persons who may require additional screening prior to becoming more physically active. We want to make sure, again, that someone is in a stable health status, that they are under the care of a doctor, and that a doctor knows that they're going to be exercising, or we are helping them to identify if they are a person that is at risk and should go and see a doctor before they start exercising with you. We also are looking at reducing the healthcare costs associated with traditional medical clearances for physical activity participation. We have seen in the past that sometimes when you go to your doctor or even nurse practitioner, when you are getting any kind of a form filled out, there's a fee. And you understand it because there's time that's taken out of the appointment time to do some paperwork for you. So we want to reduce that cost for both the professional, the doctor, nurse practitioner who's working with a client, also the time for the client, so that we can get people into the exercise system faster and more efficiently. There's also a new risk stratification and physical activity participation clearance strategy markedly reduces the barriers to physical activity participation for everyone. Because it's just one form that you have to get them to fill out, it's pretty quick, it can happen, and they can immediately kind of get into the class or activity. Now, these forms used to stop at age 69, but the PARQ Plus is meant for everyone, regardless of age, sex, or health status. So here's what the online version of the PARQ Plus looks like. The website has been recently updated. There's a little bit of a new look to it, and there's lots of different options here. So there's information about the actual forms that are used, about where it was created. There are print versions, there are online versions. Let's look at that next. So we're going to start with the print version, just so you can kind of get an idea of what this kind of looks like. Every year they create a new one, so it'll actually have the year on top, whatever the year happens to be. And the questions have not changed in at least the past 10 years. So you could use one from a couple of years ago, that would be fine. But really and truly, if you have any chance at all, you should use the most current one. So this one is the Physical Activity Readiness Questionnaire for everyone. We want to make sure, again, that people who engage in physical activity are going to be safe in doing so. So it starts off with general health questions. Now, again, if they answer yes to any of these questions, you are not able to look at them unless you are a qualified exercise professional. And what I mean by that is a degreed professional with additional training, in order to determine if a yes on here is going to immediately allow them back into the class. Question number 1, has your doctor ever said that you have a heart condition or high blood pressure? Question number 2, do you feel pain in your chest at rest, during your daily activities of living, or when you do physical activity? Number 3, do you lose balance because of dizziness, or have you lost consciousness in the past 12 months? Number 4, have you ever been diagnosed with another chronic medical condition other than a heart disease or high blood pressure? Number 5, are you currently taking prescribed medications for chronic medical conditions? Number 6, do you have or have you had in the past 12 months a bone, joint, or soft tissue problem that could be made worse by becoming more physically active? And number 7, has your doctor ever said that you should only do medically supervised physical activity? On the bottom of the print version, there is this disclaimer. If you answered no to all of the questions above, you are cleared for physical activity. You can start becoming much more physically active and slowly start building up gradually. We want to make sure that people are following the exercise guidelines for their age. You may take part in a health and fitness appraisal. If you, though, are over the age of 45 and not accustomed to regular, vigorous, or maximal effort exercise, consult a qualified exercise professional before engaging in this intensity of exercise. So basically, what this is trying to do is trying to highlight those people who maybe have not screened out on the top that they are someone who has any one of those conditions or symptoms. But if people are over the age of 45 and have not been regularly active, again, regularly active here is defined as 4 days per week for a minimum of 6 weeks, then maybe they need to start at a low to moderate intensity level of exercise. It's where we should be starting everybody who's brand new to a program, just so that they can get a feel for it, and also so that we are keeping them safe while they are exercising. Now, this is someone, if you think about it, there's those, you hear about it all the time, weekend warriors. So someone who maybe doesn't exercise a lot, maybe they don't exercise for the whole summer. They get back and maybe they're doing a hockey program, a seniors Friday night hockey program, and it's 2 hours. So not only has this person not exercised for the last kind of 2 or 3 months, they have not exercised in the capacity and the intensity level that that sport is going to require. Then they get out on the ice, they go crazy because they're there, there's peer pressure, they want to be active, they want to be in the game. And this is when sometimes events can happen, sudden cardiac events. So we want to make sure that we kind of offset this by giving people enough information that they know that let's start off low to moderate, let's move ourselves all the way up to vigorous to maximal effort once we are ready to go. Now, there's another disclaimer on the bottom. If you answered yes to any more, to one or more of the questions above, so that is the questions 1 to 7, complete pages 2 and 3. So 2 and 3 are actually screening questions that allow you to go a little bit more, or the client to go a little bit more in depth on their answers. Again, the challenge with this is that once they answer yes to a question on the front page, then they answer yes to a couple different questions. As an exercise professional without advanced training, I am not qualified then to be able to say to them, yes, you are cleared for exercise, let's go. You will have to refer these people on to someone who has more training to determine if their high blood pressure that is not under control is a condition that would allow them to participate in your class. We're going to get into that a little bit more, though. The online version does a much better job at this. Another piece on the bottom here, delay becoming more active if you have a temporary illness such as a cold or a fever. It is best to wait until you feel better. If you are pregnant, talk to your healthcare practitioner, your physician, a qualified exercise professional, or complete the ePARmed-X. This is another document that we're going to talk about today. If your health changes, answer the questions on page 2 and 3 of this document, or talk to your doctor or qualified exercise professional before continuing with the physical activity program. And then the last page of the 4-page print version has a declaration that basically says that they have provided you with their the information to the best of their knowledge. You would have them sign it and date it. You would sign and date. And then at this point, you would retain this copy. And we're going to talk about what that looks like a little bit later on. Now, in order to see how the online version works, it makes sense to run through a scenario. A scenario is going to allow you to get a handle on how it works for a specific person for their specific conditions. Now let's start off with Jerry. Jerry is your average 46-year-old man who has put on some weight. He has a busy job, busier home life with 3 kids, and has no time to go to the gym. Well, that's where he was at before, but now he's looking to make a change and he wants you to be his personal trainer. So let's start with the online version of the PARQ and the ePARmed-X online. So because Jerry is someone who we feel does not have additional chronic conditions, he hasn't indicated that he has any, and he's definitely not pregnant, let's start with the PARQ Plus. The PARQ Plus, here is the preamble. The health benefits of regular physical activity are clear. More people should engage in physical activity. We want to make sure that it is safe for most people. Let's see if you require any further information before participating in this program. So here's the 7 questions, and I've answered these questions pretending like I was Jerry. So this is not something that we're supposed to do, but it helps you to understand from Jerry's perspective what this process looks like and what it would look like for the fitness leader as his answers kind of come out the other end. Has your doctor ever said that you have a heart condition or high blood pressure? We're going to say yes, because we're going to say that he has high blood pressure. Do you currently have a bone, joint, or soft tissue problem that could be made worse by becoming more physically active? We're going to answer no. Since you answered yes to one or more of the questions above, we ask that you complete a short series of questions to gain further information prior to providing further recommendations. So this is that extra pages 2 and 3 of the print version. And so again, when you look at it online, it definitely is easier to see that that the person who is filling it out will now know exactly where they have to go. So let's look at high blood pressure. This is a follow-up question. Follow-up question, do you currently have high blood pressure? The answer is yes. Do you have difficulty controlling your conditions with medication or other physician-prescribed therapies? Answer no if you are currently taking medications, if you are not currently taking medications or other treatments. So Jerry, he knows he's been to Safeway. He put his arm in the blood pressure cuff. He knows that he has high blood pressure according to the machine at Safeway, but he hasn't actually gone to his doctor, and he also hasn't looked at medications or anything like that. And so this is going to ask what his resting blood pressure is. So do you have a resting blood pressure equal to or greater than 160/90 with or without medication? Answer yes if you do not know your resting blood pressure. So we have his numbers, and they're slightly above this, so he answered yes. So here's where the next piece kind of comes out. So at the end of the PARQ Plus that they're taking online, this is what comes out at the end. Thank you for completing the following question regarding your medical condition. Please sign and print off or save this page as required. Your answers to this survey indicate that you should seek further information before becoming more physically active and engaging in a fitness appraisal. You can contact a qualified exercise professional, a physician, or a fitness professional with additional training in order to determine if you are safe to exercise. So again, Jerry is someone who really fits into that category of 30 to 45, 30 to 50 kind of people who have not exercised very much. He has also indicated that he has high blood pressure. This is someone that you want to send for clearance before they come to your class. He's not in a stable health condition. He's not currently under the care of a doctor, and he really is not active enough to be able to say, you know what, I've been participating in physical activity and it hasn't been a problem for me. At the end of this directive that he receives, there is an opportunity for him to print off that portion of the document. So notice, we just go back here for a second. So notice it does not say anywhere in this participant declaration what the issue is. So he's going to bring this directive back to you, and it says that you should seek information before becoming more physically active, but it doesn't tell you what his issue is. Therefore, we want to make sure that we are definitely sending him off to someone like his doctor, especially with someone who may be in that risk factor for sudden cardiac incidents. Then have him print, sign, you would witness again, and keep this copy. Now let's change it up a little bit. So we go back to, are you currently taking prescribed medications for a chronic medical condition? We're going to say yes. So now we're going to pretend that he is actually on medication. He is doing what he's supposed to. What does that change as far as the directive that's created? So right here, we're going to put that he is listing conditions that he's taking medication for high blood pressure. So we're pretending that Jerry has gone to the doctor before coming to our class, and this is a new Jerry taking the PARQ plus. So it says, your answers to the survey indicate you should seek further information before becoming more physically active. Why is that? Well, high blood pressure is one of those precursors to sudden cardiac incidents. So even though he is on medication, he needs to have his doctor basically sign off and endorse the fact that he can go exercise and he will not be putting himself at additional risk. Now, let's move on to something a little bit different. The ePARmed-X is another document that is available online. There used to be a print version available for it. There does not seem to be a print version available for it anymore, but that's okay because we don't necessarily need one. This is one that you definitely want to have people fill out online because there are a lot of questions that you would want your participants to go through without you having to maybe talk through them, especially for the pregnancy piece. There may have been some issues in the past that maybe they don't want to share with you, but it is important that they know that they have to disclose it during this ePARmed-X process. So question number 1, is there a chance you might be pregnant? The next question is, do you have a pre-existing medical condition such as high blood pressure, heart disease, abnormal heart rhythm patterns, respiratory disease, diabetes, cancer, arthritis? So if you had answered yes to either of these 2 questions, at this point we are going through a prenatal option. It says, have you developed any of the following conditions? A history of miscarriage or premature labor in previous pregnancies, anemia or low iron, malnutrition, or any other significant medical condition? If you are uncertain regarding the history or presence of any of these conditions, please answer yes to this question. So if they answer yes to this question, the answers that you provide indicated that you have a healthy pregnancy. So they have said no to all of these questions. They've said, yes, I'm pregnant, and then no to everything after that. The answers that you provided indicate that you have a healthy pregnancy and you are ready to become more physically active. It is recommended that you consult a qualified exercise professional to help meet your unique needs. Now, this is a different wording in a different kind of situation. So in someone who is a pre or postnatal client, you would hope that they would be looking for someone who has experience and education within pre and postnatal. So we have a number of pre and postnatal fitness leaders, but if you have someone come to you and they are a prenatal client and you have not had the training that you require in order to deal with them, you really want to make sure that you're providing them with very good information. The directive at the end of the pre and postnatal ePARmed-X questionnaire indicates a couple different things. So it actually indicates what are the aerobic and musculoskeletal recommendations for exercise. So the aerobic exercise should be increased gradually during the second trimester from a minimum of 15 minutes per session 3 times per week to approximately 30 minutes per session 4 times per week. So it really gives you some really good guidelines as a fitness instructor as to exactly what is the recommended dose for exercise for this client. There is also muscular strengthening general guidelines. So pregnant women with healthy pregnancies are recommended to engage in various exercises that improve the health of their muscles and bones. It is recommended that you condition large muscle groups during both prenatal and postnatal periods. So again, it's going to give you a directive on what are the things that you should be doing. There's even some examples of exercises that they should be doing with your client. One of this really important parts, now the challenge is that this is in the directive, but it's something that they really have to understand well. Reasons to stop physical activity and exercise, you want to have them consult their healthcare provider if any of these things happen. If while exercising, they have an excessive shortness of breath, they have painful uterine contractions, they have any sort of vaginal bleeding, any kind of gush of fluid, any dizziness, fainting, or chest pain while exercising. Again, just like the PARQ Plus, there is a participant declaration that prints off on the directive at the end of the PARQ Plus, or the ePARmed-X. Okay, moving back through the ePARmed-X with someone who has answered yes to more than one chronic condition. So as soon as you answer yes to more than one chronic condition, it immediately directs you to seeking further information before becoming more physically active or engaging in a fitness appraisal. It is recommended that you visit a qualified exercise professional with advanced university training or your family physician for further information. Now, again, if this person has been cleared for exercise already from their doctor, from their physician, or from a qualified exercise professional, they are good to go as long as they have already been cleared by someone. But if they have not been cleared by someone, you should be sending them to someone with more training to prescribe exercise for them. It is also recommended. So this is an interesting piece. I often get people call the office and say, I had someone drop into my class today. They didn't have a PARQ, they didn't have this, they didn't have that, and they wanted to participate. What should I do? So it's interesting. They have added a disclaimer in this one that says, this does not mean that you cannot perform any physical activities. We recommend that you only engage in low intensity physical activity until you have received clearance from your physician and or have met with a qualified exercise professional. So if they show up to a circuit training class, it's going to be pretty hard to keep them at a low intensity physical activity level. If they show up to an aquatic exercise class, there may be more chance that they are able to do very low intensity physical activity, and encourage them to get to their doctor and get clearance before the next class. Now, another thing that I hear of a lot in the office is people saying, there's another questionnaire out there called the Get Active Questionnaire. So why aren't we using that one? Well, the Get Active Questionnaire is something that was developed in Canada by the Canadian Society for Exercise Physiology. And it's a little bit different. So it has used some of the content from the PARQ Plus and some of the information from the ePARmed-X, but it is only available in the print version. So there's no directive that's kind of given at the end of it, regardless of what the answers are that people give. So here's where we are. It says, for almost everyone, the benefits of physical activity far outweigh any risks. For some individuals, specific advice from a qualified exercise professional, has post-secondary education in exercise science and advanced certification, or healthcare provider is advisable. This questionnaire is intended for all ages to help move along the path. It also indicates that we, as exercise professionals without university degrees, are not able to give specific advice based on their answers on this document. So again, it's just kind of like the 7 questions that we had on the PARQ Plus. So imagine those questions are standing kind of alone. There are a couple of follow-up questions on the Get Active Questionnaire, but again, we would have to be able to look at that information and determine whether someone with X chronic disease would be safe to participate in our class. And that is not our job. Our job is to provide people who are apparently healthy and screened and qualified for exercise, participation in exercise through either a clear PARQ or a PARQ where they have been vetted back into the apparently healthy group. Therefore, we do not recommend using the Get Active Questionnaire, and it is not covered under your scope for the Manitoba Fitness Council. We talked about this a little bit earlier, but what do I do with the completed PARQ Plus forms after the exercise session? I know as fitness professionals, we may not think that we have a large administrative role in exercise, but in fact, we need to create a safe place to store this information and these documents for up to 7 years, especially if you are a contractor hosting the classes yourself. If people register through you, that sort of thing, you have to have that kind of information and be able to keep it. Now, if you work in a facility where there's registration kind of being taken at the front desk and you are either a contract staff or a staff person who's delivering classes in a gym or a studio, it is probably going to be the facility's responsibility to keep those PARQs. More than likely, they are not going to want you to have a copy of those that you are taking home. Okay, so it's a little bit convoluted, I get it, but we just want you to understand. So if someone is using the paper version, we have the 2022 PARQ Plus paper version. If they have no responses, you only need page 1 and page 4. If you're doing the online version, no responses, meaning no positive responses for any kind of chronic condition, all they need to do is bring the computer directive printout to you. And it's easier because there's not health information on it. So it's easier to save. On the paper version, if they have any yeses on page 1, they would have to follow up with pages 2 and 3 and then sign the 4th page. If on the paper version, they say yes to questions on page 1, which would be those 7 questions, and yes again to the questions on page 2 or 3, at this point, you either are sending them through the ePARmed-X online to get a directive, or you are sending them to a exercise professional, meaning someone qualified with university education, or to their physician. So in order to get your CECs for this, there are a couple of different scenarios that you can take and run through the PARQ Plus form online and see what the responses are, see what the directive is. So we have a couple different options. We have Bill. Bill is 60 years old. He has had a knee replacement. He is otherwise active, and his weight is 30 pounds overweight. So if you were to do the PARQ Plus for Bill, what would that directive say? And I'm not asking you necessarily to anticipate what it would say. I'm asking you to go through the process, pretending that you're Bill, so you can have an understanding of what that looks like. And so that when the directive comes out the other end, what does it say? We have Tammy. Tammy is 35. She's pregnant in the 6th month of her pregnancy. She's been walking 30 minutes per day throughout her pregnancy, and she has no health concerns. Which form would you use? Would you use the PARQ Plus or the ePARmed-X? What would be the directive that comes out at the end of the scenario? Scenario 3, we have Bob. Bob is 47 years old. He has been very inactive. He is interested in losing 60 pounds and getting back into shape, and he has no health conditions. Which form are you using for Bob? Are you using the PARQ Plus? Are you using the ePARmed-X? What does the directive look like for you when working with Bob? Last scenario, Sue. Sue is 55. She has had a previous cardiac incident. She has been hospitalized in the past 6 months for heart issues. Which form are you using for her? Are you using the PARQ Plus? Are you using the ePARmed-X? When wrapping up, The PARQ Plus should be your screening tool of choice. I hope by now you've had an opportunity to understand why the PARQ Plus was developed, who it's developed for, how it's used, and what can be the ramifications if you don't use it when you are screening your participants. When possible, have participants fill it out online. You could see as we ran through the scenario with Jerry how easy it was for the fitness instructor to know exactly what to do with Jerry. Jerry, we are sending to his doctor to get medically cleared before he comes back and participates in our exercise class. When in doubt, refer to a higher qualified fitness instructor or healthcare practitioner. So sometimes we have someone who, just for whatever reason, we are just not feeling comfortable with the responses that they're giving. There is always someone else that we can look to for help. And if you need help finding that person, you can call us at the Manitoba Fitness Council or send us an email. But if you're looking to get your credits for watching this video, pick one of the scenarios presented and send the completed directive to info@manitobafitnesscouncil.ca, letting us know which scenario you chose. Thanks for watching.